my god, that keeper tree guy is so stupid. He doesn't even know how to record correctly. He's so dumb. What is the matter with him? Like, oh my god. Alright, so anyways, guys, I'm back now, and I fixed the recording, as you can see. So, and it was a really stupid thing. So I'm gonna do the brain surgery over again. Unfortunately, this was a pain in the ass if you actually stuck with the crappy video I put up and watched that. So, but I do well at the brain surgery. Anyways, I do good at brain surgery, so let's just start it up here. I also got the add-ons for the eye surgery and stuff. So this here is my friend Doug. It's not Bob anymore. It's my friend Doug. He's suffering from a small brain, and well, I'm sorry, Doug, but we'll fix it up. Don't worry. You're in Dr. Tree's hands now, so you'll be perfectly fine. And listen to that squishy sound when you touch his head. Okay, so Doug, you gotta let go of my hand, buddy. Thank you. All right, so Doug, we're gonna use this. This is called a hammer, Doug. No, I'm just kidding. I fooled you. All right, I fooled you again. Hold on, Doug. All right, so I still fooled you. All right, Doug. So this is a hammer. We're just gonna have to just ever so carefully just smack you in the face with this, Doug. It'll be perfectly fine, Doug. I'm sure you will be okay. Perfect. Good job. See that, Doug? We're getting places here. It's good when you cooperate with me, Doug. It really helps out the cause of removing your abnormally small brain. And I am a doctor, so I know that the brain you have right now is very small. Although it does not seem like it, it is a very small brain. But we will fix it, Doug. Don't worry. We can fix your brain, Doug. Now, I am just going to, you know, like, rub this around like that, and then I am just going to try and get inside of your skull, Doug. You gotta cooperate, though, buddy. You're gonna have to let go of this skull. I mean, when I put your brain back in your head, you're not gonna need the skull, and you're probably not gonna need the skin either. So, you should just really let me just take care of you, bud. You know, Doug, I really think that you and I are gonna be good friends, Doug. So I just believe that you need to stop bleeding and just allow your good friend Jack here to operate on your skull here, pal. Okay. So we're ever so carefully just taking off all of that. So hang on, Doug. We're gonna inject you with some weaponized Ebola and inject it into your useless brain to stop you from bleeding. Okay, perfect. Alright, so now we are going to make an attempt to just pull your brain out of your head. Okay, perfect. Thanks, Doug. Alright, so now we just need to get that out of the way, and if you'll excuse me, I need to grab this tool here. Ever so carefully just pick up this tool and... No, not... Alright, well, you see that, Doug? I'm so nice, even just in case I missed it, you know, Alright, there you go. Perfect. I need more of the magical needle that is stuck to whatever that is. You are bleeding profusely, Doug. That's not good. Alright, so... we are going to now just ever so carefully stick our hand into this water as soon as hand figures out how to get in there. And grab your new brain, and we are just gonna pick this up now. And we're just gonna put it inside your head. Perfect. See that, Doug? I'm a genius. And you were worried about last night when I was telling you I was gonna perform all of these operations on you. See, now next we have to fix Doug's eyes. You know, Bob came in for a heart and kidneys, but we need to fix Doug's eyes. So, let's get started. I'm sure you'll be fine, Doug. Trust me, Doug. I'm a professional. I know what's best. I am of the utmost certainty that I know exactly what is best. Now, see, Doug, we're gonna have to cut this off of you. I know you didn't want me getting your eyes, so you put this this nice little goggle thing on here, Doug. But that's you shouldn't have done that, because now I'm going to have to take this scalpel to the side of your head until you decide to remove the said object that is preventing me from doing my job as a professional doctor. Doug, you're gonna have to work with me here, pal. No. Come on, Doug. Come on, Doug. Oh, okay, well, Alright, here we go. I know you're bleeding a little bit, but Doug, you're gonna have to stop letting me stab you in the side, and perhaps there we go. Okay, perfect. Now, Doug, I may or may not have just accidentally stabbed you in the eye. I am sorry. Okay, so now there we go. Perfect. Next, what should we do? Right. Okay, Doug, I'm gonna stop you from bleeding to death because I'm a good doctor and I care about you, Doug. But this Beaker apparently does not, because he will not let me shake that out, please. Thank you, Beaker. Alright. No, apparently the hammer doesn't like you either, Doug, because they will not let me get this either. Perfect. Just poke that. There you go. See that, Doug? I know what's best. I know what to do. And I also know that we have these patented eyeballs here for you. Okay, so those are going to be the lucky 2 eyeballs that you can wear, Doug. I don't know if they're real eyeballs, but I can tell you this, Doug. This will be fun. Alright, so now, Doug, you see this? You see this? Can you see it, Doug? Doug, can you see it? Alright, I'm sure you can see it. Alright. So, I'm going to need to use this to drill into your eye socket. Okay, And I'm apparently shaving your eyebrows now, Doug. You don't need those. Trust me, you look better without it. Well, you'd actually look better with a mask, but I mean, you look better without it anyways. Alright, so let's get started. Doug, you gotta look up, buddy. Alright, I guess you just want me to go to this eye, huh? You'd preference if I were to get this eye going, huh? Or am I gonna have to stick a scalpel in your eye again, Doug? Because that's what I know I need to do eventually. And let me tell you, Doug, I don't like doing that to you, Doug, but I believe that's what we're gonna have to do because you're being a big wise ass about this, Doug. So I think that's what's gonna have to happen to you, Doug. You're gonna have to get the special treatment. Doug, I'm sorry, buddy, but we've got to take this here, these here, tweezers here, and we're gonna have to stick them into your eye cavity, and that will be excruciatingly painful considering you're probably still awake for all this, because I do not think the other doctor who is not as good as me, gave you the correct medicine to put you to sleep. So, and I mean, I could, right, but you know, I think that since people have to learn from that mistake, Doug, and I think that humility is the best thing. So maybe when the doctor sees that I am killing you because he did not manage to put this into your eye correctly, come on, Doug. There you go. Come on, Doug. You want to eat this? Let's go. Oh, I hate this game. I can't even keep up my act anymore. I just hate this game. Get in your face, Doug. Did you just reject that, Doug? Did you really? Huh? Huh? Alright, Doug. You know what, Doug? That's fine, Doug. I didn't want that anyways. I think I'm gonna have to use a scalpel. This will probably be excruciatingly painful for you, but I think it's what's necessary, okay? So just if you would keep your eye open. Again, I need you to keep your eye open. And then I can just force my way into your eye socket with my scalpel. Oh, that's good. Okay, this is good. Let's just try and... There we go. Okay, so now your eye is apparently removed from its rectal cavity. Doug, I'm gonna have to ask you to look up, please. This is gonna be extremely painful for you, but not me. Because I am a doctor, and I know when things are painful. Oh, good. You know, this is... I don't really know if I like this. I've never really liked when people do things like this with their eyes, and this is kind of gross, to be completely honest. I'm sticking this into his eye to push his eye out of its socket for whatever reason they would have to do that. And it's kind of grossing me out. You know what, Doug? You're playing hard to get... Oh, no. Oh, okay. I thought I knocked off the one needle I needed out of all of the other needles and sharp objects they provided me with. I mean, Doug, if I had the choice, I would beat those eyes out of you with a hammer to save your life, Doug. I know that I'm doing a life-saving surgery here, because I'm a good doctor, and I know that everybody needs to be able to see. So if you would just ever so kindly stop moving, if I had a second hand to hold him in place... Doug, I'm gonna kill you, Doug. 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 Hey, Doug, just put this in your eye. Alright. So now we've got that in the patient's eye, as you can see. This is completely normal. There's nothing to worry about here. He may be suffering from some blood loss, but we can easily stop that blood loss there. We just need to get down here and just kind of meh. Alright, so now we just need to get the blood. Okay. Needle. That's a bad place to be. Okay, so now if you'll excuse me, Doug, I'm just going to stab this into your other eye, and your eye will fall out, because that is what this drug specifically does. I know, because I'm a professional doctor, and professional doctors are highly trained in everything. I took an online course in human biology. It was of the 8th grade level, and this is what they said you are supposed to do. So now, I'm going to stab this needle into your other eye, and hopefully it will come out now. Okay, no it won't. So I think what needs to be done now, Doug, is because you're playing very hard to get, we're going to have to take this, and we're going to have to insert this into your eye, Doug. This is what we call a tweezer device, okay? This is a very high voltage electromagnetic tweezer, and you're gonna have to. You know what, Doug? I think we should just do this the old-fashioned way, like my dad did it with his patients. I think we should just use a pencil. The chances of you surviving are a lot better with these pencils, Doug. Believe me, I know. I did it to another patient just like you named Bob, except it was with his intestines. But I think that the pencils are the way to go, Doug. So, just shove that in your eye there. There you go. Very good. Very good. See, that's perfect. So obviously, Doug, I'm just kidding with you, and I know that we need this scalpel here to remove the eye from its cavity. And then if I just push it into your eye a lot, you will... You know what? We're going to use this vibrating thingy. Where'd it go? Oh, it's on the floor down there. Okay, we're not going to use that vibrating thingy. We're going to have to play this the hard way. So... blunt force trauma is sometimes good for you, Doug. I'm just going to tell you that now. Let me just get the other eye out of the way here. I think that's what's stopping us, Doug. What's stopping us from making progress was that other pesky eye that you don't need. Trust me. We don't need that. I have plenty of eyes to use. Okay, there we go. See that, people? I'm a brilliant doctor. I know what I'm doing. So now we just need to administer some anesthetic to the patient and smack him in the head. There we go. See, he stopped bleeding. Alright. So... now we just need to cut the other eye out. Man, this place is starting to look like a real doctor's house, huh? Alright, no, we don't need that. We need this. We need this. Alright, come on. Come on. Hang on, Doug. I promise I'll get you there, Doug. Alright, now I just jab this into your eye that you don't need anymore, and we'll be good. Now, I have one last scalpel, so this better work. Alright, Doug, I know you're nervous. This is a big thing to go through, Doug, but I believe that you will be fine after I cut this out of your face. There we go. Alright, Doug, so listen up, buddy. Here, would you like this kind of eye? Or would you like the other kind of eye that I can't seem to find anywhere? Where are your eyes, Doug, huh? They seem to be all over the floor. So, I'm gonna have to pick up this eye right here. Okay, any day now. Come on, pick up the front scope! No! Here, Doug. Doug. I got this, Doug. Alright, look, Doug. This is what you do, okay? You shove it in your patient's eye really carefully. Whatever way it goes in is fine. Alright, that's not what we do. Okay. Welcome back to 420 Just Blaze Simulator with my friend Bob here. Because I accidentally hit the needle and dropped the blue needle off, we are going to have to play the whole entire game like this. Alright, well, this whole entire level like this, unless I start over. But I don't want to start over, Bob. Honestly, Bob, you know, I don't want to start over. And I feel as though you should really let me just stab you in the eye with this scalpel and push your eye out of your place. Alright, you know what, YouTube? I am going to be right back. I'm just going to edit out everything I do until I get both the eyes out, because this is going to get boring fast. So, yeah. Bob, what are you doing, Bob? You're kind of scaring me a little bit, Bob. Bob, sir. Look, What is going on? He's like twitching. Did we forget to give him the painkillers again? Dang it, nurse! Yes, nurse, we forgot to give him the painkillers. Oh, jeez. Nurse, Nurse, we've got a problem with the patient. The patient seems to disagree extremely with what we're doing here. Holy crap! I know I said come back when the eyes are out, but I think I found something better to watch than me taking the eyes out of Bob's head here. So, yeah. So, Bob, what you doing now? Bob. Look, Bob. See, it's just one more. Alright, Bob? You'll be good soon. Just calm down, Bob. Alright? Bob, everything's fine. You know, everything is awesome. That's copyrighted now, but everything is awesome, you know? So you just gotta relax. And let doctors like me be professional about this and do their job correctly. God. I know why all the ladies like you, Bob. Look at you go, Bob. Look at that, Bob. That's some insane stuff right there, man. Let's just stick this into your other eye, please. Oh my. Bob, are you okay? Bob, you don't look too good. Hang on, Bob. I'm gonna have to apply some anesthetic here because... Bob, I'm pretty sure this is not how a patient's supposed to react to this type of this type of surgery. So, Bob, just hang on 1 second, Bob. I just need to stab myself. Thank you. Okay. Now, Bob, you see, you need to calm down, sir. Sir, now I have to stick this into your arm or something. There we go. Alright, that's a better rate for him to be doing that. Alright, now, Bob, I guess you don't want me to put them in both at once, so I'll just pull this one out now. Fine. Right, I need this now, though. So, yeah. It's alright, Bob, trust me. You look a little worried, but it's alright. It's alright, just accept it. There you go. Perfect. Okay, so now that it's just been accepted, we have to wiggle this from side to side, okay? This is going to be extremely painful, Bob, but there's nothing I can really do about it. Well, there is something I can do about it. I can have the nurse give you more drugs and stuff, but I don't think that's necessary with you, Bob. I think you know what's best. I think we know that you don't need it. Alright. So now, I just need to get the eyes out of your head somehow. It just isn't coming out. So now I'm going to have to take this and just kind of poke you in the eye with it until your eye comes out. But this is what I'll be doing for the next 45 minutes, so yeah. I found the spoon. Oh crap, and there goes all my eyes. Let's see here. Get this here spoon. And if I just stick the... How did your eye come out, Doug? Doug, I never gave you the order to remove that eye from its socket. Alright, look, I must have slapped you around so much you don't even remember. Alright, Doug, we're just... see, spoon works! Told you, spoon... Flying pencils! We have a poltergeist in here? Somebody call Zach Baggins. Somebody call Zach Baggins. Holy crap. Alright. So now what we have to do, Doug, you see, is... just... We need to cut your eyes loose. They need to be set free. And that blood is splattering onto the invisible glass wall that is preventing me from being a successful doctor, which is your face. So I'm going to have to ask you to just let me get your eye out of there. Alright, so you're beginning to bleed to an extremity. There we go. Okay, so now we need to carefully... No, uh-oh. Okay, we don't need to carefully do anything now. We need to put our skills to the test here and pick up an eye. Oh crap, I can't see anything. Okay, so I need to get this in there. And go eye fishing. Come on, somebody give me an eye. Holy crap. Can I give you the 8-ball? That would be really amazing if I could have the 8-ball. Okay, so Doug, you want to help me out here, buddy? I don't really know how to put an eye into your socket. Where'd the eye go? Oh. I understand that time is of the essence here, people, but Doug here does not want these new eyes that we are so graciously going to be providing him with. Perhaps, maybe. Yes, I need the tomahawk. Ah, crap, I just hit him in the face. Oh, God, I'm sorry, Doug. I'm so sorry. Oh, jeez. Alright, Doug, here we go. One eye goes in there. Doug, I'm sorry. I'm really sorry, Doug. I never meant this to happen, Doug, honestly. Never meant this to happen, Doug. Alright. This is Bob. This is actually Bob. Bob, I'm sorry. Bob. Bob, we gotta get this in your eye now, Bob. Bob, look at me, Bob. Alright, look at me, Bob. Yes! That sucked. Terribly. It sucked. See you in the next surgery.